Hello, my name is Bailey Chappis, and today I want to talk to you about child abuse. So, a lot of times people think of child abuse as being simply just physical abuse, but oftentimes that's not the case. Child abuse can happen in many different forms. It can happen in a domestic way, sexual abuse, neglect, just simply not caring for the child's needs that they are required to have. Verbal abuse, emotional abuse, so yelling at the child and anything that could hurt their self-esteem or anything like that. Many different aspects influence the incidence of child abuse. So lower socioeconomical classes tend to have a higher incidence of child abuse. As well as technology. Technology can be a great thing, but at the same time it cannot be in the cases of these children. So using technology for the purposes of abuse against a child, such as child pornography, can really be detrimental. But at the same time, technology can be a good asset in reaching out to children who weren't abused or raising awareness for child abuse in the local community. Another thing that can play a part into child abuse is spirituality. So sometimes abusers can bring a spiritual aspect into the abuse, relating it to a type of sin or something like that, and that can stray the child away from any type of spiritual relationship in the future. So many of these things play a part in the abuse of a child, and a lot of times can be detrimental. So today I'm going to tell you a little bit about the bill HR 1658, which is a bill that was to adjust the Child Abuse Prevention and Treatment Act, just to kind of raise awareness and also make programs available to healthcare systems in general, and providing them more grants and abilities to provide care to the children that were abused that come into their facilities. So this bill was introduced by Mickey Sherrill in New Jersey. There was no bipartisan support and no co-sponsors as well. But this bill will play a large role in the future of healthcare, and especially for me as a nurse in the future, having the ability to have these programs that will allow me to better care for these children that come in to the facility that I'm working at and care for them in the way that they need. So I think that starting more community outreach centers with this program in the lower socioeconomical communities would help to lower the incidence and maybe care for these children in a better way, especially staffing these programs and community outreach centers with staffed professionals that are trained to care for these children, and also having a better training system for healthcare providers in general of how to care for these children who are abused. I think that would really benefit the future of child abuse and hopefully decreasing the incidence of it. Thank you.